our second webinar. And well, my name is Diane. I'm a dentist with master and doctorate in the field of laser. And today I'm here to talk about managing pain with photobiomodulation. As Betsy says, I'm not a pain specialist, but of course a photobiomodulation specialist, so I can show you how photobiomodulation can help on pain. So let's go, managing pain with photobiomodulation, our webinar number 2. Well, making a link to our previous webinar, photobiomodulation is not a new tool, but light. And light is energy that helps injured tissue to regenerate. This energy can be delivered to biological tissue by a laser handpiece, providing what I really like to call that is a cellular energy nutrition. So that's what we saw in the previous webinar. We talked about photobiomodulation and the applicabilities in dentistry. And today we're going to focus on pain. But once again, it's important to understand that the wavelengths that we use in dentistry are totally safe. Red and infrared do not cause any damage, and we use light that is in the visible and infrared spectrum away from ionizing radiations. Of course, we always need to use protective glasses because the only danger of this kind of light is to the eyes. Divining is the job of relieving pain, but divine also is the pain for being a survival tool. So pain is a warning sign that helps protect the body from tissue damage. And what do conventional treatment cause for us now and for the patients? And why we are looking for another option to treat pain? So we have a lot of side effects of drugs, inefficiency over time, psychological effects, and opioid epidemic. So this is very difficult thing to go out. And in US, 10 to 3 million people misused prescription opioid in 2018, causing more than 130 people to die every day. So this is a very important thing that we have to think about. So have you ever searched for pain treatment without side effect? The growing answer is the photobiomodulation, but not many professionals know about it. And so I'm here to tell you about the benefits. The effects of photobiomodulations lead to cell regeneration, returning the cell to its energetic and functional homeostasis. They provide modulation of inflammatory process that leads to reduced pain, edema, and accelerate regeneration. And also vascular and lymphatic results are noticed through the improvement in the microcirculation, immunological, systemic, and hormonal regulations, improving the patient's general health. So the macro effects of photobiomodulation goes on the reduction signs and symptoms of inflammations as reducing pain, reducing edema, reducing local temperature, reducing erythema, and also that laser accelerates and tissue, accelerates cells and tissue regeneration and accelerate function restoration after an injury. So then let's see how photobiomodulation can help pain. Here, a very simple graph and cascade of pain path. So the harmful stimuli starts like an exogenous stimuli, for example, mechanical, chemical, physical, and biological. And also we have some endogenous stimuli like inflammation, tissue ischemia, and also everything goes to injury tissue. So after the initial event, we have this release of or synthesis of biochemical mediators, the cytokines that involve the pain process, and histamine, prostaglandins, and bradykinin goes to interaction with peripheral nociceptors and free nerve endings like fibers A and C, and then goes to deflagration of pain signals from the area of the tissue. So how photobiomodulation will act in these events? So first, we can have a direct action of the photobiomodulation in the injured site. So photobiomodulation accelerates tissue regeneration, which minimizes the inflammatory response. Here's some articles, and also the laser versus nerve recovery. So the literature says that laser is very have a good results on nerve regeneration. The second thing is the action in the injury region around the injury site. So photobiomodulation works in modulation the inflammatory process, inhibiting and reducing the release of inflammatory cytokines, while reducing nerve sensitization that leads painful stimulus. And also it's nice to say here that the main pain process starts with the inflammatory cytokines. So it's very nice to have laser as an anti-inflammatory to avoid the pain. The other thing is the action on nervous terminations. Photobiomodulation blocks nervous stimulus temporarily, promoting immediate pain relief. So sometimes with the light energy, we can see in the literature that the energy blocks the nerve potentials, so we can have immediately stopping the pain. And this can also be seen in the root ganglion. Photobiomodulation blocks nervous stimulation, so we can irradiate the spinal cord depending on the region of the pain. Also, it's very important us to remember that we can also find some referred pain, and sensitization of nearby fibers then cause the referred pain that is in another location far from the source of the pain. So the action of the light on the root ganglion can avoid this referred pain. And in dentistry, we can see a lot of cases of this, like from the tooth, we can have pain in neck, in ear, in head, in muscles, and for the tooth, originating also from sinus or otitis, facial neuralgia. So it's very common we have this referred pain. Here's some papers that show us how laser can reduce membrane potentials and block axonal flow, explaining how laser provides immediate analgesia. These papers were published by Roberta Shaw from Australia, and she's one of the references in photobiomodulation pain treatment. So here is the summary of how photobiomodulation managing pain. Number one, immediate analgesia via blockade of nerve transmission. Also analgesia via reduction of the inflammatory process. And finally, analgesia via regeneration of injured tissue, or for example, nerve tissue that cause neuropathic pain and makes treatment difficult to resolve. So when we are talking about orofacial pain, we should go to acute and chronic pain. Talking about acute pain, there are many injuries that can cause pain, such as trauma, surgery, thrush, orthodontic activation. And the treatment with photobiomodulation is simple, and the results are also very quick. So it's easy to do it. It's easy to perform. For example, here some videos of the local irradiation, and it's easy to treat acute pain. If you remove the cause, or if you give energy to the tissue to regenerate, we just finish this kind of pain. And one example that I need to talk about in the treatment of is the treatment of oral mucosites. I don't know if you already saw any picture of mucosites. Here's a very ugly one, and talking about mucosite degree number 4. So the patient is hospitalized because of the mucosites. And mucosites causes so much pain that many patients think about stopping their chemotherapy because of this. And we can also do 2 kinds of treatment. We can do prevention of mucosites, or you can do treatment mucosites. The interesting thing to talk here is when we do prevention, we should irradiate during the inflammatory process. And the inflammatory is in the first 3 days after a chemo or radiotherapy. And the results are very great because, for example, in these patients with multiple myeloma, if we do irradiation every day, the patient will not feel anything in the mucosa, and no mucosites will appear. Here are another patients with lymphoma, Hodgkin lymphoma, and also doing laser in the inflammatory phase, no mucosite will appear. So this is very nice because this kind of patients have a lot of pain. So talking about this irradiation for immediately postoperative period, for example, after trauma, after surgery, or after a small lesion or mucosite, we have here some considerations that you can keep for your clinical practice. So the first one, the better results are obtained when the laser is performed in the immediately postoperative period, and the modulation of inflammation will be effective, avoiding then pain, edema, and accelerating tissue regeneration. So do the laser as soon as possible. Using laser in the post-surgery is a way to prevent also the chronic pain. We know that the chronic pain comes from not well treated process. So sometimes if you have a lot of medications, the process will not heal appropriately. So this will lead to a chronic pain. This can lead to a chronic pain. Laser also should be applied over the entire inflamed area in a scanning form and with multiple wavelengths, ensuring the penetration and absorption of different tissue chromophores. The dose related to the modulation of inflammatory is usually around 3 joules per square centimeter, and treat for at least 3 consecutive days after surgery or trauma. The introduction of the laser in the treatment can avoid the use of analgesic and anti-inflammatory drugs. And of course, it does not replace antibiotics. Now we are going to talk about the chronic pain. And the treatment of chronic pain requires more attention. And we will now address some of them with example. But let's see the 3 major types of this by the symptoms and organ system involved. We have, for example, musculoskeletal pain that for example, TMJ, temporomandibular disorder. We have neuropathic pain, trauma, neuralgia, burning mouth syndrome, atypic pain. And also we have neurovascular pain, for example, trauma and migraine. So let's start with TMJ. That is one of the major topic and affects a lot of people. And also we have a lot of patients looking for this treatment in our private office. So the literature leads to that we should do photobiomodulation for TMJ. A lot of papers telling nice things and good results. Here, for example, meta-analysis. This is the most recent systematic review. Revealed positive effects of photobiomodulation in pain relief. Here they got a total of 31 studies to include in this meta-analysis, and suggest that photobiomodulation effectively relieves pain and improves functional outcomes in patients with TMJ. There's many other studies in the literature showing the benefits of laser in managing pain and inflammation in temporomandibular disorders. And photobiomodulation is effective in treating pain, and it is a good treatment options for patients with interest in non-invasive complementary treatment. It's important to say that it's a complementary treatment because we have to remove the cause of TMJ. So the laser can avoid the anti-inflammatory, the analgesic medications, and can help to treat this kind of disease. Here is an example of a clinical case treated with class 4 laser, showing the improvement in mouth opening. Here you can see the pictures of the patients before and after. And the frequency of irradiation should be every day if the patient shows acute pain. Radiate every 48 hours if moderate pain. And sometimes a single dose is enough. For example, in tension pain. The dosage is quite like the literature says us to irradiate 3 to 4 joules over the entire area. Or we can also irradiate over trigger points with 4 to 6 joules. So once temporomandibular disorders are a set of clinical conditions with signs and symptoms in mastigatory muscles, temporomandibular disorder, and associated structure, we should irradiate this area, these mastigatory muscles, the temporomandibular joint, and associated structures. So here are the areas that we should irradiate. And according to the literature, laser has been seen as a complementary option, and due to its analgesic, anti-inflammatory, regenerative effects with no reported adverse effect, good acceptance by patients, and pain reduction leads to better jaw motion, chewing, and mastigatory performance, like you can see here in the video. Well, according to what your patient's symptoms, such as neck pain or trigger points, you should go and irradiate directly these areas. So in the TMJ is usually the irradiation on the cervical area, and we have to look for trigger points to do the irradiation and to solve these areas of tension. Here, the consideration for you for clinical practice. So we can find immediately analgesia, greater patient engagement in treatment. The average duration of pain control is about 48 hours. You should repeat after 48 hours if needed. And shows the place of irradiation according to the injury. If you want, for example, to block the nerve conduction, laser the Gacillian ganglion right here. Also, we use this area to irradiate when you treat neuralgia, that we're gonna see this later on. And remember to irradiate healthy tissue if you want to have immediately analgesia. Overdose over the inflamed area could inhibit the regeneration. So if you need analgesia, choose healthy tissue to irradiate over. Now let's talk about trigeminal neuralgia. Photobiomodulation has been used in an alternative treatment for pain control, especially when the patient does not respond to drug treatment or is recurrent despite surgery. And we have very nice results and publications about this. Here are some examples of publications. This review, for example, summarizes the scientific papers from 1986 to 2011. And low-level laser therapy could be considered in treatment of trigeminal neuralgia without any side effect. And here the average of session was 30. Another two nice papers from the last 5 years. The literature still recommends laser to treat neuralgia. And here's some recent article, 2020, 15 patients, 16 sessions. And here we can see the pain in 10 patients out of 15 from pain score 8 to 10 dropped to 0. And the remaining 5 patients also got better. So very nice results and recent results. And for treating neuralgia, the frequency of irradiation should be every day for 3 days, then twice a week. We should evaluate the possibility of reducing medicines as the intensity and frequency of pain reduce. The number of sections goes to 5 to 10, and then we should reevaluate. The dosage goes to 4 to 8 joules per square centimeter over the entire affected area. And also it's nice to irradiate the gazillion ganglion with 8 to 12 joules per square centimeters in a pulse way to block the pain by blocking the nerve tissue. So we should ask the patient, where is the pain? And then irradiate the area. And we can irradiate this area right here, or in the middle, or in the mandibular, depending on what path of the trigeminal nerve was affected. So do the diagnosis to see which branch of the trigeminal has been affected, which patient refers pain, of course. So make the radiation on the affected area and the gazillion ganglion, and use as soon as possible, irradiate as soon as the patient start the pain, then you can control better the results. So another thing that is very interesting to treat now, and will be the next, not the next, but one of our next webinar, is the burning mouth syndrome, and known as burning tongue or burning mouth. And the burning mouth syndrome are now recognized as real small fiber neuropathy. And laser treatment improves nerve regeneration as well as stimulates neurogenesis and synaptogenesis. So we can see that photobiomodulation can be effective in decreasing the symptoms of patients of burning mouth syndrome. Here the literature, laser improves symptoms in patients with this kind of pathology. Here are some articles. It's a very nice area right now. We are doing a lot of nice clinical cases irradiating tongue, and salivary glands. So what should we expect from laser? Laser can reduce symptoms and pain. The extraoral laser treatment on the salivary glands aims to promote their regeneration and also stimulate the production of saliva. And in addition, regeneration of the lingual papillae can be done by intraoral laser treatment on the tongue. So we use this laser to irradiate, and we look for anti-inflammatory and regenerative action over the papilla and also minor nervous fibers. Also, we should irradiate minor salivary glands and major salivary glands with phototherapy. And here's a case report. This patient has this altered symptoms and pain and burning sensation. And here the photo after 1 month of treatment, the left one, and the right one is after 2.5 months of treatment. The interesting thing that we did was thermographic images. And you can see in the upper left side, the regular healthy tongue, very red. And in the bottom, we can see the tongue of this patient before and 2 days after the irradiation. So you can see the improved microcirculation. And what we can see here, the blue area that have a low temperature, that means a little bit of ischemia. And after the laser, the microcirculation was improved, so you can see less blue areas. So about nerve irradiation, here's some clinical practice consideration. So the entire nervous tissue path must be irradiated with a regeneration dose that goes to 1 to 4 joules per square centimeter. A blocking dose in nerve root can provide immediate analgesia to the patient, so it's very nice to irradiate the gacillium ganglion. Laser every 48 hours at the beginning. If patient reports clinical improvement, the sessions can be spaced, reaching weekly, bi-weekly, monthly sessions until the end of the treatment. And situations when the patient's psychological dependent on the laser can be managed with sessions held every 2 or 3 months. So why Horizon? Why class 4 for pain management? The first thing is the penetration VIP. So using pulsing laser, we can have the best penetration. Also, we do fast irradiation once we are using high power. But at the same time, we are doing therapeutic efficiency because we use probes that are about 5 centimeters square that guarantees low irradiation intensity. Well, what mean watts per square centimeter. So we are guaranteeing that we are doing photobiomodulation, not photothermal effects. Also, we have multiple absorption target, or what means multiple chromophores, when you use 4 wavelengths. And this is very nice in this equipment. We have 650, 810, 915, 980, and all these wavelengths have a different chromophores and enhance the results once we have more targets. Well, note that in the last 60 years, we have seen a lot of improvements in the equipment, and that has resulted in better clinical performance. So from the helium neon laser, now we have this very nice Horizon diode laser class 4, helping us getting the best clinical results. So I can say that this equipment is the state of art in dentistry phototherapy. And also inside the equipment, we have this complete clinical guide software that help us during the clinical practice, doing a step-by-step clinical guides and going to clinical approach that can be intraoral, extraoral. We can irradiate lymphatics, nerve tissue PET, nerve root, or systemic. So inside of the software, we have all the picture, all the videos. We have the option to use this large application tip for outside irradiation, or also we have an inside tip, intraoral application tip that is much better to do intraoral irradiations. Also, videos tutorials are available to professionals. And here I am doing a demonstration of irradiation on the lymphatic chain that can be used to prevent or treat edema in the situation of installed infections. So it's very nice for the clinicians, because you have all the step-by-step, and you can learn how to treat, and you can learn and you can practice just with the patients in the chair. So here's so laser brings dentists the opportunity to provide better quality of life and less systemic harmful effect. And this is a very nice conclusion, because we are choosing for light instead of medication. And this is just the future of medicine. So thank you very much for your attention. Here are my contacts. And I wait you guys for the next webinar that will be held in October 22 at 6 p.m. East Side. And the topic will be how to promote an incredible post-operatory experience for your patient. So thank you very much. I think I'm on time. It's 18:42. It's 6:42. And now I'm open for questions. I don't know if it was much fast, but I hope you enjoy.
Diane, can you see the questions on the panel? Let's see.
Yes.
Okay.
Should I go in the beginning of the chat, or let's see?
Why don't you start at the bottom and work up?
Let's see if I can see the chat. Is that what you're talking about? Ah, yes, I can see here. Let's see. I'm gonna start by the last one, okay? Can laser treat atypical odontalgia? Well, this atypical odontalgia we treat like neuralgia, as the same way we treat neuralgia. So it's hard to define if it's neuralgia or atypical odontalgia. So we always look for the cause. And if we don't find any cause, then we think it's about neuralgia, and then we treat like this. So we treat the ganglion ganglion, and then the path of the nerve that the patient relates the pain. So we do the blockage here, and then regeneration of the nerve in the path. That's how we treat this kind of atypical odontalgia. What is the most common cases you treat? Well, in my everyday practice, I work a lot with oncological patients, preventing and treating mucosites. But in the second place is the neuralgia. So neuralgia is one of my everyday practice here in my office. Do you have a list of a clinical study and where it can be found. Yes, I can send you the articles. I use it for this presentation if you need, Alfred.
Hey, Diane, can you see on the Q&A panel, we've got a question from, I'm going to assume you all that that you're doctors. It says Ethan Glickman, so I'll say Dr. Glickman. He says, please talk about herpetic oral lesions.
Hold on, what it is? Idiopathic?
The herpetic, herpes.
Oh, herpes. Oh, okay. Yeah. Okay, herpes is fine. Well, herpes have a lot of phases. We can irradiate in the prodomial phase. That's the first one when it starts itching. So when we do that, we irradiate the trigeminal also because the virus is situated there. And then we irradiate all the path and the local where is itching. So this is the prodomical phase irradiation. If the patients have the herpes, then we do a very light irradiation with red light and also all the path, and we include the lymphatics. If we have in a vesicle phase, we love to do the photodynamic therapy. We put blue ink, methylene blue, and then we irradiate with red to kill the virus. So it's a very nice way to treat the vesicular phase of herpes. And if we are in the last phase, that the regeneration phase, then it's pretty much easy to do. Is just irradiate with red light every day until the conclusion and the total heal. Okay. One more question here. How many sessions are needed to treat burning mouth syndrome? Well, at least 4. And a lot of patients with 4 sessions is fine with the burning mouth, but depends on the cause and depends on the psychological things of the patient, how the patients are. But at least 4 sessions will be enough to treat the burning mouth. How is your experience treating trigeminal neuralgia? Yes, this is the second place most treated pathology here in my office. Well, in 2010, I went in a congress called WALT, World Association for Laser Therapy, in Bergen. And there I presented 10 report cases. And from them to today, I've been treating like more than 100 patients, I guess. And the experience is like this. In the beginning, the patient is a kind of, you know, I don't know if it works or not, but then they start to feel less pain, and also the frequency of the pain is diminished. So the patient's getting very nice. Oh, I'm believing this treatment. And then as soon as the patient's getting better, we started to reduce the medication. So sometimes we need 10 sessions, sometimes we need 40 sessions, depends. But every day, every session's nice results. The pain management is very nice, reached. We can see the patient feels better. And sometimes the patients are afraid to stop laser, and then we have this dependency of light, but that's okay. We do this once a month, twice a month, or once one time per semester, just to keep the patients fine and say, oh, you are being treated and we are preventing the next pain. So it's quite nice to work with this kind of patients.
You'll see another question came in on the Q&A. We have them coming in on the chat and also on the Q&A screen. And Dr. Glickman asked again, is there any relief with pericoronitis? Did I say that right?
Oh, pericoronitis, yes. Yes, sure. In the pericoronitis, we also, well, we start irradiating the TMJ area because usually this kind of patients have a trismus. It's very, because of the pain, is tied, and then have this kind of trismus. So we start irradiation the muscles and the TMJ area, so the patients can open the mouth better, so you can reach the pericoronitis. And then we do the conventional cleaning with, well, depends what kind of medication you use to clean. But also in this kind of pathology, we recommend the photodynamic therapy. We put the methylene blue and then the red light to kill the bacteria, and then to modulate the inflammation, and then the pain also get much better. So this is how we treat this kind of thing. What else?
I think that might be our last question that's on the board. Does anybody else have any questions for Dr. Meneguzzo? No. Diane, why don't you pull up your slide one more time to show our next webinar?
Oh, yes.
Yeah, we can end with that. And I want to thank everybody for listening today and participating. I did get the question twice in about the studies, and Diane did say she can send them to you. On the chat, I also sent, we have our own website where we have compiled a bunch of studies. So I sent that on the chat, but we can also send that out in an email to you as well. It's nice to be able to look at them all in one place. So thank you for joining us today. And our next webinar will be October 22nd at 6 p.m. Eastern Standard Time. And we are going to explore the topic, how to promote an incredible post-op experience for your patient. We look forward to seeing you again.
Thank you very much, and see you in the next webinar. Bye-bye.
Bye.